Chinese medicine is based essentially on the laws of nature. We look at the human body as a microcosm of the macrocosm of the universe. We're subject to the same laws. So that's was the attraction to Chinese medicine for me. Is it made so much sense because the essential laws of nature are uncompromisable, right?
And we're not separate from nature.
We're not separate
Yeah,
from that.
yeah.
So you and I are part of that same macrocosm. We're subject to the same laws.
Today we have a really exciting guest right here. We have Dr. Michael Berger with Community Cures. Welcome. I'm glad you're here.
Thank you.
Yeah, I'm really excited to learn from you today. So welcome to Community Cures. And would you mind introducing yourself and we can just kind of get started from there?
Sure. My name is Michael Berger, and I have a owner and operator of a Chinese medicinal clinic in Salt Lake City. I don't know what else you want.
Yeah, we know we
to
can
proceed,
take it.
but
Yeah, that's great. So I'm really excited to learn. So you do acupuncture, qigong, and what else do you have?
well, I have a pretty wide background.
Okay. Can we dive into that?
Sure.
Awesome.
Sure. It probably started after I graduated from school in Utah. I graduated from the University of Utah. I went to school initially on an athletic scholarship, a wrestling scholarship to Utah State University, but ended up graduating from the U of U. And after graduation, I was kind of investigating what I would do, and I was looking into some different professions like the CIA, FBI. I was thinking about going to the military to try to become a Navy SEAL, and then I had a job offer to go to Japan. And I was quite involved in martial arts training at that time. And so I ended up going to Japan in about latter part of 1983. And that's how I kind of became interested in the whole Asian culture and martial arts. And that's where it all kind of blossomed there.
So you had a job offer.
Yeah.
And then so before that, your interests were you hadn't even been introduced to a lot of that stuff before that?
I had not, no.
Okay.
I had not. I was always interested in medicine, and I originally was a PE major, and then I thought, it's a little bit too, I don't feel I'm really learning a lot, so I decided to try pre-med and got into the upper division kind of chemistry classes and so forth, and I thought, this doesn't make any sense to me. You know, I don't know how I'll use this. So I ended up graduating with a degree in English, and so I had a job offer to go there and teach English in Japan. But my primary reason for really going was I wanted to become more immersed in Japanese martial arts.
And what was it that sparked your interest in that, or what drew your attention into that, going that direction?
I just really I really felt a kind of a kinship with Asian culture, and I was quite involved in karate training, and I have some Native American Indian blood in me, so I feel it was kind of a kinship with Asian culture. So that's why I initially went.
So how long were you there when you first went, and when did you start like training or like really making the decision to go that route?
Yeah, I had been training for several years here.
Okay.
I was a brown belt, and then I went to Japan, and that first time I stayed about a year and a half straight. I ended up spending about 4 years there over a 10-year period. But I trained at some very elite programs there. And I ended up, competing in the All Japan tournament twice, a world tournament 3 times.
Wow.
And I just really got immersed in the martial arts training. And while there in Japan, I was training for a World Cup. I was a member of a U.S. team at one time. And I became injured. I had a pretty severe calf injury and had a lot of injuries, actually. Blew out my knee, had to have knee surgery and different things. But I was able to try acupuncture for the first time there in Japan. So that
to treat your injury.
Yeah, to treat my calf injury. And it was kind of a funny story because I met this Japanese person, and he said, "Oh, I can help you," and he came to my home to treat me. I was laying on a tatami mat, and he I was laying on my side, and he did bleeding therapy on my leg. So it's essentially like a micro kind of a incision, and then he used cupping bleeding, and it was very, very effective.
Wow.
Yeah.
Could you explain acupuncture for those that might not understand what that is?
That's a big
I'm sure we've
subject.
all heard the word, but like as far as the details go and like what it consists of.
Yeah, well, if you look at like the history of Chinese medicine, it goes way, way back. Perhaps as we don't know for sure because of written records, but we can definitely, there's definite evidence to like the 3rd century BC. That's a book called the Huangdi Neijing. That's called the Yellow Emperor's Classic of Chinese Medicine. That's kind of like the quote unquote Bible of Chinese medicine.
Okay.
But there is some evidence that acupuncture and traditional Chinese medicine may go back much, much further, perhaps as 10,000 years. So the Han Dynasty, when the Huangdi Neijing was written, was probably, about roughly 2nd or 3rd century. And but the Shang Dynasty, 10,000 years ago, there's some evidence that acupuncture may have existed way back then.
Really?
Yeah.
So you have a practice here locally in Salt Lake then?
I do.
And how long have you been based in Salt Lake with that?
I've been based here. I went to school in China, and we can get into that whole thing if you want. But
Yeah, absolutely.
I graduated in 2012 and opened my clinic here in Salt Lake in 2013.
Very cool. So you went to Japan and then you went to China.
Correct. I went to
Okay.
Japan. I went back and forth to Japan over about a 10-year period, and all for karate training. I was very, very involved in it and so forth. And so eventually I settled in Los Angeles, and I opened up a school there, karate school. Had about probably 80 students.
Wow.
And but in the back of my mind, I always had an interest in Chinese medicine. So I started school in Santa Monica, California, while I had my karate school. And at the same time, I was teaching at a teaching school at a private college prep school. So I had this idea that I really wanted to go to China, to look around and to check out the Chinese medicine there.
You just felt a call.
Yeah, I just felt a call. So I had one day I was walking in Glendale. I lived in Glendale. I was training there with Sensei Takayuki Kubota, a very famous Japanese master. And I went to an art show, and I saw a beautiful painting of some mountains. And I asked the artist, I said, "That is fantastic. Where is that?" And he said, "That's in China." And he said, "That mountain is called Huangshan." And I said, "That's fantastic. I want to go there." So I intended to go there for my birthday. And I told my brother, I want to be on top of that mountain for my birthday. So we went, and that's kind of how the journey began into my investigation of Chinese medicine.
Yeah. So you had, so your initial, I guess your initiation into it was you actually being treated and with acupuncture.
Correct.
And then what made you kind of want to do that for other people?
Well, it made so much sense to me.
Yeah.
It just, I looked at allopathic medicine and Western medicine and the use of like pharmaceutical drugs to treat everything kind of seemed like a Band-Aid to me. And it's like, they say in Chinese that it's kind of akin to if a bucket has a leak in it, they just keep filling up the bucket with water instead of repairing the leak.
That's a great analogy. Yeah.
Yeah. So I thought Chinese medicine is based on so many things that made so much more sense to me. So that's kind of why I went that direction.
Yeah, I love it. Could you walk us down that path? What that looks like? What? I guess let's talk about acupuncture first. Let's
Okay.
go into that a little bit and the healing art of acupuncture, and then I know that you also I want to talk about qigong, and then I looked at your website and you have
Yeah.
meditation
Correct.
going on too. I
Yeah.
would love to dive into that and like what
Yeah.
style of meditation or what that looks like as well. Can we talk about acupuncture first?
Sure.
What would a acupuncture treatment, someone that comes into your facility, what would that look like for them?
Okay. So first of all, I'll say that it's really, I think, kind of a mistake to separate acupuncture from the whole body of traditional Chinese medicine.
Okay.
So it's one component. It's one very important component. But if you really want to get into the essence of Chinese medicine, it consists of acupuncture, Chinese herbal medicine, qigong and other health practices, food medicine, and things like moxibustion.
What's that?
Moxibustion is a kind of it's an herb. It's a Chinese herb called ai, which is a mugwort,
Mm-hmm.
and we use this herb for warming and nourishing. So
Yeah, they'll make teas out of that all the time and stuff like that.
they
right?
can use it in teas, but more often we use it topically.
Okay.
So we burn the herb either on the ends of needles,
Mm-hmm.
or we do it directly onto the body, onto a piece of ginger or onto salt and so forth. So it's a very effective means. So for us to separate acupuncture out, it's a good question, but I think that they really all work together.
Yeah, it's part of a whole holistic practice. Yeah.
Exactly. It's
Yeah.
part of a whole entire medicine, you know.
Yeah.
Acupuncture itself, there's a saying that says in Chinese medicine that says "yi zhen er zhou san yao." That means first intervention is of the Chinese medical protocols is acupuncture. If acupuncture is not enough, use moxibustion. If moxibustion then is not enough, use Chinese herbal medicine. So the whole principle is to use the least invasive kind of methods first.
Mm-hmm.
Okay?
Which makes way more sense, and it's such a balanced approach compared to like what you were saying with like in the West, where it's like Band-Aid on Band-Aid on Band-Aid instead of
Yeah.
trying to like start somewhere that's kind of simple or at the root of it and then kind of go from there instead of just like ignore all of that.
Yeah, exactly.
Right?
Exactly.
Yeah, interesting. So, so where does qigong lie in this?
Qigong is really, if you look at the characters, it's really a kind of a better translation is, if we look at the translation of qi, it's very difficult to translate to English, but it's composed of the character. Part of the radical includes like air. But in fact, if you have a flat tire on a bicycle and you go to the bike repair shop to get it fixed, they'll say there's no qi.
Mm-hmm.
So there's no air. It's almost the same, but qi is really can be kind of translated as a universal life force.
Mm-hmm.
And gong just means work or skill. So basically, qigong is just working with qi. It's just skillful manipulation and skillfully working with qi.
Mm. Like the awareness of your life force energy and using that and working with it.
Exactly.
Okay.
Exactly.
So it's a practice like with, so how does one practice that though?
Yeah, it's actually qigong. Its predecessor was called Dao Yin.
Mm-hmm.
That was, and it's a series of kind of exercises that, I mean, in the earliest stages was called Dao Yin, then became Qigong. There's a kind of a series of movements.
Is it similar to Tai Chi?
To Tai Chi,
Okay.
and so Tai Chi came from those predecessors.
Okay, cool.
So it would look similar to that.
Mm-hmm. Yeah, I mean, I've seen a lot of like group groups at like parks that are doing qigong,
Yeah.
and it looks like a very meditative practice, but it's also like a subtle physical practice as well, right?
Yeah.
And so do you is that something you do daily and that people come into your facility to work with and like learn?
Yeah.
Or is that not part of
I'm not really teaching it at the moment. I have in the past. I will sometimes prescribe some qigong exercises for some of my patients.
Cool.
So and I've taught it at some larger kinds of events, like some Zen retreats and so forth. I've taught the qigong when they do the exercise portion.
Yeah. What
So-
benefits come from practicing that?
Well, it's mainly for longevity.
Longevity.
Yeah, so it's mainly so. Another saying is 经络畅通百病不生, means when the channels and meridians are all clear and in harmony and free from blockage, 10,000 diseases cannot be born. So
Cool.
that's kind of the essential purpose of it, is to kind of
Clear your energy centers.
clear your energy centers, keep everything flowing, and the energy systems in harmony. Okay, because they all have relationships to the organ systems. So
Yeah. And I mean, yeah, like the whole body is like one thing as well, with multiple, kind of like the practice itself, where it's like so many components, but it's one thing, where it's like these practices kind of help, I guess, from what I'm understanding, kind of just clear everything that's going on in your body, so you can kind of like approach illness from a more centered place or a more clear place, right?
that's a good analysis.
Is that accurate?
Yeah, that's accurate.
Okay.
And now just to go a little further, I'll say that Chinese medicine is based essentially on laws of nature.
Okay.
So that's why we can treat diseases that Western medicine has not even identified yet, because we have a different kind of model. So to your point, we look at the human body as a microcosm of the macrocosm of the universe, right?
Right.
So we're subject to the same laws. So was the attraction to Chinese medicine for me. Is it made so much sense, because the essential laws of nature are uncompromisable, right?
And we're not separate from nature.
We're not separate from that. So you and I are part of that same macrocosm. We're subject to the same laws.
So understanding what's happening in the mechanisms or the laws, it's like you can start to work with that and benefit from actually understanding.
Exactly. And just to give you an example, like I have a lot of difficult kinds of cases of patients who come into my clinic because they've exhausted all the other possibilities of Western medicine. The doctors have like thrown up their hand, nothing else we can do. So they're like, okay, I'll try acupuncture. I'll try
As a
Chinese.
last resort.
As a last resort, you
Yeah.
know? And so even very, very difficult diseases, some that perhaps many people haven't even heard of or haven't been identified, we approach it from a very simple model. So, for example, we use one example of the ways we use five element theory, or we may use 8 principles, which is the disease hot or cold, dry or damp, excess or deficient, yin or yang. We use these kinds of principles or 6-stage identification. We use these kind of different medical models that align with the principles of nature, right? And in that way, we can identify, like H1N1 was a good example. At that time, Western medicine didn't even know what to call it, didn't know what it was. Chinese medicine was treating it effectively already.
Wow.
Okay, so.
Yeah, that's impressive.
Yeah.
You know, I find it so cool because like some of the things you're talking about, we've had people come talk about even things like Ayurveda in India, and they'll talk about things like hot and cold and all these different elements that it seems like here we're just barely like kind of touching the surface on that here in the West, right?
Exactly.
Yeah. Wasn't acupuncture illegal here for a while, like back in the 70s or something like that?
Well, I'll tell you how it came to America. It's an interesting story. It was here to some extent even when the
But there was pushback, right?
yeah, it was here, but it was during the time when the Chinese immigrants were brought here to help build the railroads and so forth.
Okay.
There were small communities where they were treating each other, right? But it didn't become really rise to prominence until Nixon's visit to China.
Okay.
Okay, I think that was 1972, if I recall. I might be wrong, but at that time, before Nixon arrived in China, one of his assistants arrived there before, and he had an acute appendicitis. So he had to have an emergency appendectomy, and for treatment of the pain post-surgery, they gave him acupuncture. And it became a very, very big story. So became publicized by James Reston, I believe his name was. And
Because it works for him.
because it worked for him.
Yeah.
And so this brought light to the Western world about acupuncture. Then in about the early 70s, there was a group in California. California was one of the first states to legalize it formally, but there was a group of Western physicians who wanted to meet with some Chinese medicine practitioners and find out about it, right? See if they would legalize it. And so they met, and they said, these doctors questioned the Chinese medicine doctors, and they said, we don't know about this stuff. It seems like, all foo-foo, maybe it's power of suggestion or something like that. And these doctors said, okay, we'll prove it to you. We'll do it on horses.
Wow.
So they went to a track where a number of horses had gone lame, and they did acupuncture on the horses. And I think it was like 5 of the 6 horses were able to then get up and walk.
That's amazing.
So then, the doctors were like, okay, I guess this stuff
There's something
really
here.
does work.
Yeah, there's something here.
Something here.
I find it so crazy. It's so interesting that a lot of the times it's like seen as a last resort, like you mentioned.
Yeah.
Instead of where you had, the steps where it's like, first we touch here, then we go here. If that doesn't work, then we go here.
Yeah.
But instead it feels like here we're just like last resort because none of this is working. None of our system here is working. So we're going to try this. And there's a lot of I see today it's kind of, people are actually needing to look in that direction though. There's a lot of sick people out there. And it seems to me a lot of it starts too with the food we eat, right?
Yeah, true.
Our mindset even. So I kind of want to touch on meditation.
True.
Because a lot of that I'm sure bleeds into, the physical, right? And so what style of meditation do you practice, or did you?
That's
there's probably a lot of them, but
there is. Yeah,
I'm just curious to talk about that.
And I don't want to say one is better than another or anything, but that's another area that's really coming to prominence. In the West, right?
Almost as a last resort too.
Almost as a last resort. And I think it's a combination of things. Like you said, you touched on food, you touched on high stress levels. The world is changing. It's, there's a lot of anxiety and stress and depression and these kinds of things. And the whole thing with artificial intelligence and phones and computers and
what do we do?
What do we do, So people are turning to meditation. Now, I started with meditation. I was fortunate enough to have been introduced to it when I was about 13 years old.
Okay.
Actually, my dad, he had been a school teacher in Southern California, and we moved to Utah, and he had some stress, and so he enrolled in the program, and he enrolled our whole family.
Okay.
A blessing to me.
Absolutely,
So we studied initially transcendental meditation.
Okay, yeah, it's mantra based, right?
Yeah, it's a mantra based.
Okay.
Maharishi Mahesh Yogi was the founder of it, and that was the one that the Beatles were involved with.
Yeah, it's
for some time.
So transcendental meditation and then Vedic meditation. I'm familiar with Vedic meditation, which also comes from Maharishi, and I think it's the same style almost.
Similar.
They're similar at least, right?
Yeah.
Okay.
And then, several years later, I became involved, because of my experience in Japan and so forth, I became involved in Zen meditation.
Mm-hmm.
So
Is Zen where you just it's not mantra based, it's just like sitting meditation?
um, there are two main schools of Zen,
Okay.
the Rinzai school and the Soto school.
Okay.
So those are kind of the main Japanese branches
Mm-hmm.
of now there's also Chinese Zen that goes way back, so there are different forms there, but they're generally not mantra based. They're either called, Japanese word is shikantaza.
What does that mean?
Shikantaza is just sitting,
Just sitting.
just sitting,
Just sitting.
no mantra, nothing. You start by just, you start by following the breath,
Mm-hmm.
and then you really should not have a goal, right?
You're
Y-
just
y-
there.
You're just sitting,
Yep.
right? The other main Japanese school of Zen is the Rinzai school, and that involves koan study,
Okay.
right? Where your Zen master gives you a kind of a difficult to solve
Like
kind
a
of
paradoxal poem or
like a
something.
riddle, a kind
Riddle.
of a thing, and you can't solve them with the linear mind.
It breaks your brain.
Yeah. It's the way that we are taught to think. You can't solve these that way.
Yeah.
Okay, so it kind of breaks you out of your normal way of thinking.
Gets you out of the analytical mind.
Exactly.
Yeah.
Exactly. And then there are, as you mentioned, there are many other forms of meditation now. I follow a guru now, Guruji Sri Ravi Shankar.
Oh, I know him. Yeah.
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 So if you're familiar with his work, The Art of Living,
Yeah.
that's really, really good practice
Cool.
too. So any time that we can slow down,
Calm the nervous system.
calm the parasympathetic,
Yeah.
sympathetic, parasympathetic nervous system, and just calm everything and slow everything down, we can live a more fulfilling, more present life.
Yeah, I mean, like you mentioned, like we're kind of bombarded with so much information and a fast-paced society that's just like ever progressing, and it
Yeah.
can get confusing and overwhelming for a lot of people. So having practices like this is something that's so beneficial. It grounds us and it kind of keeps us present, and then we can kind of simplify our lives a little more and have more clarity, right?
True.
Yeah, that's beautiful. I love that. Do you have any success stories with some of the work that you do that you could share with us?
Oh yeah,
Some
I
that
have a
come to
lot of
mind?
them. Yeah, the one that comes to mind that was very rewarding for me is I have a former patient, and maybe at some point we could, if we do another show or
Absolutely.
something, we could bring some of these people on. But when I first returned from China, I spent 4 years over there.
Mm-hmm.
So I did my master's and PhD work over there. Completed the master's. I was not able to complete the dissertation for the PhD, but right when I came back and opened my clinic, somebody in my neighborhood contacted my mom and asked if I could help. There was a gentleman in my neighborhood, was a retired 4-star general, Air Force. He had been a chief of NATO in Europe. He'd been shot down twice in Vietnam, fighter pilot. And he was, retired and all. And he was getting up in the night to use the restroom and tripped over something, hit his head on a nightstand. And he thought it was just a bump on the head, but the next day he was having severe headaches and went to the ER, and he went into a coma. He had a subdural brain bleed. And so he was in a coma for a couple of weeks, and everyone was praying for him. They thought he wasn't going to make it, but when he came out, he could not speak, and he could just barely move his limbs, And I got permission to go into the hospital to treat him. And I went in to treat him every day, probably for the first 2 weeks. and then gradually every other day, and started to treat him like that. But even on the first day, I knew a certain protocol for treating this kind of condition that I had learned in China, and it involved very strong stimulation of the needles.
Mm-hmm.
And even after the first day, he could raise his arm and his leg maybe this far off the bed. So he's fully recovered now. He fully recovered within several months.
Wow.
And so that was a very touching and rewarding case for me.
Yeah. I mean, just being part of that journey or someone's healing journey is probably very rewarding, just to witness, right, and be part of that.
Yeah.
Yeah.
Yeah. And, there have been a lot of others. There have been, cancer patients, and I'm treating a patient now with chronic heart failure. So a lot of people don't understand. They think acupuncture, well, that's like for back pain, right?
Yeah.
But they don't realize the complexity and the nature of Chinese medicine, that we can treat many, many things. And even a lot of clinical trials are coming out now, for example, about this, chronic heart failure,
Mm-hmm.
and treatment using acupuncture and Chinese medicinal herbs.
Mm-hmm.
So,
So just to backtrack a little bit about kind of like the energy centers and everything, is what
Yeah.
acupuncture is doing, is it connecting different points? Like you mentioned meridians.
yeah.
So are you, with treating a wide variety of ailments, you're connecting different points to kind of like open that center? Or is that close?
That's close.
Okay.
That's one. There are a lot of different kind of subsets of acupuncture methods and treatment styles.
Yeah.
Some of them are based on what's called zangfu. It's an organ relationship to the channels.
Mm-hmm.
So you would have, say, a lung meridian, right? Or a spleen meridian or a kidney meridian channels that have organ relationships. So you influence the organ systems with acupuncture.
Gotcha.
There are other styles. There's a style that I'm familiar with called the Lingui Bafa. Lingui Bafa is called the turtle style.
Mm.
This is very interesting. This one, you have like, you impose the image of a tortoise on the abdomen. And for example, to treat a foot injury, you would treat the area of the turtle's foot.
Oh, interesting.
This is another style.
Yeah.
Okay.
So there's a lot of like systems, like it takes a lot of expertise understanding the system, but then it's like also like an intuitive.
Exactly.
Yeah, it has to be. It's not just checking the boxes and then giving a remedy.
That's right.
There's a very complex system that you have to really become an expert in, but then you're intuiting that with each patient.
Yeah.
Okay.
Exactly. And so all of these different systems, and the ones that are really intriguing to me are the very old ones that have, like I studied a style called the Jiugong, the
Okay.
9 palaces. The 9 palaces is derived from, are you familiar with the I Ching?
Yeah. Yes.
Okay,
Uh-huh.
so all of this comes from the I Ching and the Bagua, and these it's very complex, but it's so fascinating. It makes so much sense. So all of these principles are rooted in very, very old classics and very old principles.
Yeah. It's
So
fascinating.
It's more than, like you say, it's more than just like a point prescription.
Yeah, checking off a box from
Yeah.
them telling them some symptoms. It's not.
Exactly. It's
yeah.
not like, okay, they have a cough, use this point,
Mm-hmm.
It's not like that. You need to get, so we say, 变报. We need to treat the root and the branch.
Mm-hmm. And it's a
Right.
combination of multiple practices that you're implementing. And I'm
Exactly.
sure you could keep stacking your expertise and knowledge, right, and learn more
Yeah.
and more methods.
That's right.
Yeah.
So there's a couple more sayings in Chinese. One says, 学不完. You never finish studying.
Yeah, it's
The study never ends. So this field is just endless. You can just go deeper and deeper and deeper.
That's so fascinating. Where's your interest taking you today?
Um,
Currently.
Well, I'm still really interested in. I'm really interested now in longevity studies.
Yeah.
So that was my major for my PhD was called Yangsheng. That's like long life. And now it's interesting because that's all coming to light here in the West now,
Mm-hmm.
right? With you can look at the influencing of telomeres and DNA and different kinds of foods and practices and exercise to increase your lifespan,
Mm-hmm.
right? So now they're looking at, instead of like how long will you live, what quality of life you will live,
Yeah.
right?
Yeah.
And combined with how long. So you can actually get blood tests now that can give you an indication of your biological age,
Oh, interesting.
not just your chronological. So you would say, okay, your chronological age, when you were born, how many years you've been here, but your biological age may be older or younger,
Mm-hmm.
and we can influence that.
Yeah, that's so
You know,
fascinating.
so-
It's so cool.
Yeah.
So I guess my next question is, you touched on a couple different ailments, but are there certain ones that you see more than others, like that you treat more often than not?
Yeah. I would say probably the most common thing I treat is pain,
Chronic pain.
chronic pain. It
Yeah.
would either be back pain, neck pain, shoulder pain, knee pain, whole body pain, fibromyalgia, those kinds of things that involve chronic pain. That's probably what I see the most.
I did see a statistic like yesterday where it was talking about the increase in chronic pain and fibromyalgia.
Yeah.
It was up like, I can't remember the number, but quite
Yeah.
a bit, right?
Yeah.
That's
Yeah.
interesting.
It is. And these kind of difficult diseases are on the rise. If you look at, like, 50 years ago, long before you were born,
Mm-hmm.
but all of these diseases that we have today, they didn't even exist. They didn't exist.
Mm-hmm.
Like you look at like, especially children's, like ADHD,
Which is on the rise, like
on the rise like
crazy, yeah.
crazy. All kinds of anxiety disease, psycho-emotional diseases are through the roof right now.
So is that a lifestyle thing then? Is that how we're living our lives?
Well, it has to have influence on it, doesn't
Yeah.
it? The way we live our lives. But I treat a lot of that in Chinese medicine. I treat a lot of insomnia. That's a big one. Depression, anxiety, inability to concentrate, brain fog, these kinds of things. So the way we treat that is by the principle of calming the spirit.
Mm-hmm.
So
So it is a spiritual practice. Of
It
course,
is a
too.
spiritual
I mean, it's all tied into everything, right?
it is.
Yeah.
But we actually, some people ask me, well, is this just theory? Well, no, we actually have scientific evidence,
Yeah.
right?
Right.
Of how acupuncture works.
Yeah, that's fascinating.
So, and the consequences of acupuncture.
Well, I love it. I'm really inspired by what you're doing though, because I feel like it's needed now more than ever.
Yeah.
Like I feel like most people have something that they're dealing with, and a lot of people don't know where to turn. So it's nice to see resources and work that you're doing, and people all over that are actually like working and focusing on healing our communities.
Yeah.
Yeah. Where else are you working right now? Like, what else are you working on these days besides all of this stuff? Do you have any other direction?
I'm working on a few things. I also have a home in Florida.
Cool.
So I go out there about maybe every 4 to 6 weeks, and I treat some patients out there in Florida on the Emerald Coast out there. And then I've published a couple of books.
Oh, you have? What are they called?
Yeah, I published one called Dr. Jean's 3-Needle Acupuncture.
Okay.
I was a co-author of that book with 2 other Chinese authors from Guangzhou.
Mm-hmm.
And so I published that. I published a book on karate several years ago. And I'm working now, I've been contacted by a group that's starting a Chinese medicine school here in Utah.
A school. Okay.
Yeah, so I'm. They've asked me to be involved in that.
Is there currently not a Chinese medicine school here?
There's currently not one in Utah.
Okay, and so you'll be part of starting that.
Yeah, they've asked me to be a part of that.
What'll that look like for you then? That's very cool.
Well, we're in the real preliminary stages of discussion right now, but
Like, would someone be able to go and study there to become a practitioner?
yeah,
And
yeah,
okay.
yeah, it will be an accredited school,
Yeah.
a fully accredited school that's qualifies one for licensure.
Mm-hmm.
So I'm working on that. I'm also on the NCCAOM, which is the National Commission for Accreditation for the National Board Licensure.
Mm-hmm.
So I'm on a subcommittee there. They call us subject matter experts. That I'm on a committee there that works for acupuncture.
Okay. How long would that take for someone if they were interested in like going that route? Like, how long would an accreditation take? Or is that still kind of in the works, I guess?
No,
Or
it's generally a 3-year master's.
3-year master's.
Yeah,
Okay.
a 3-year full-time master's program.
Okay.
So, and I believe that this school will be doing a portion of it. We can do a lot of things online now.
Yeah, it's
Right.
There's so many resources out there.
Yeah. So it's all changed since I went to school. You had to be there in person, but
Yeah.
they have ways now that you can do intensive weekends.
Mm-hmm.
1 or 2 weekends a month, and then a certain amount of Zoom classes.
Gotcha.
So, but yeah, it'll be here in Utah, and it will be available. And
Is there a rollout date for that, or is that still in the
I
works?
think that they're going to try to. I just came back from Florida a few days ago, so
Mm-hmm.
I haven't had a chance to discuss with them since I've been back.
It's in the works, though.
It's in the works, and I think they're going to try for around the end of this year to start.
That's awesome.
Yeah,
Very cool.
I think it's going to be down in American Fork area or Alpine.
Okay, so you'll have an actual location for the school.
Yeah,
and
there will be an
everything.
actual location.
That's cool. I'm going to keep up with that. That's
Yeah,
very cool.
yeah, for
We'll
sure.
have to make sure. So where can people find your facility, your resources, your website, all of those things so that we can keep up with, paying attention to this when the school's out and all your other resources? And if anyone that's listening maybe is interested in acupuncture, any of the things we've talked about, where can they find
Oh,
you?
yeah. Thanks for that. My website is classicalchinesehealing.com.
Classical Chinese healing. Okay.
Yeah, .com. And I do have some social media pages too. I think it's Warrior Zen Medicine is my Instagram.
Warriors and medicine. Okay.
Yeah. And my clinic is there in the Mill Creek area, North Salt Lake, called Classical Ways Acupuncture.
Classical way. Okay. Yeah,
Yeah.
that's awesome. Classical ways acupuncture.
Yeah.
Perfect.
And I still do teach some martial arts. At the moment, I'm teaching mostly to only black belts, but if I have some beginners interested, I've taught all over the world. I taught law enforcement, and I taught
Oh, that's so cool.
military law enforcement. And
But that's kind of like, that's not like what you have going on at your facility, though. It's kind of like you just go and teach it when people request it, or how does
yeah,
that work?
I have a couple of regular students that
Mhm.
I teach, but my focus now is a little bit more onto the medicine and writing, academia.
Yeah. Are your books on your website?
They might be. I don't know.
Okay, cool.
Yeah, I'm not sure if they're on there or not.
Okay.
The acupuncture book is more for acupuncturists.
Learning. That'll be part of like the school.
It's a protocol for a needling method.
Very cool.
Yeah.
Awesome.
So
Well, thank you so much for teaching us all of your stuff today. I really appreciate it because, again, I mean, it's on the rise. Like all of this stuff is really on the rise, and like people are looking for healing now more than ever. And so it's really nice to hear that that's the focus of your life, and you're really helping a lot of people out. So I appreciate you teaching us today.
well, thanks so much for having me. And yeah, it's all about service and trying to help people and leave something bigger,
Of course.
and more impactful. And I'm really blessed to have been invited to come here today. So
Yeah, it's been great.
Thank you so much. I
Yeah, of
appreciate
course.
it.
Thank you. And I do want to ask one question to leave you. What kind of impact does community have on you? As this is like community cures, and we talk about a lot of healing in communities. What does community look like for you? And I don't know if it's within your work and what you do there, or whatever that might look like. But what influence?
You mean like the local community?
Yeah,
or-
local community or whatever community looks like for you.
Yeah, I think it's critical. It's very important.
Mm-hmm.
That's like kind of similar to the idea of the sangha in Zen, is the group.
Yeah.
It's all about the community. We all have to do this together. We can do more through togetherness than we can trying to do something alone.
Well, beautiful.
You know, so
I love it. Well, thank you so much. Appreciate
thank you.
you.
Thanks so much for
Dr.
having
Berger.
me.
Thank you.
Thank you.